Okay, I'll start while my PowerPoint is being set up. It's a pleasure to be invited to be part of this distinguished panel. As we all know, COVID-19 is a crisis of historic proportions. It's the policy challenge of our times at multiple levels. I want to share with you my perspective as an economist. I'm not an epidemiologist, but I'm working closely with some colleagues who are. And thoughts and reflections I'll share with you today are part of ongoing collaborations with other professors at the Schar School, including Jim Olds, who is in the COVID-19 task force, and also colleagues from other countries. And one fascinating aspect of the pandemic is how different countries have devised different strategies with different levels of success. So today I'll talk about COVID-19 and the coping strategies, focusing on the costs and trade-offs. Next slide, please. So yes, so basically, in the context of the U.S., we know that their policy response has also been of historic proportions, including, for example, the series of fiscal stimulus packages. One last that was in place will probably not be passed in the near future, but the first two were of magnitudes of the order of 10% of GDP. So why is that important? Well, the U.S. is in a unique situation in the sense that there is fiscal space galore, especially compared to other countries. Well, in general, because the U.S. dollar is the reserve currency of the world, but so the demand for treasury bills, also known as T-bills, is virtually unlimited. And also, because at this point in time, due to the Federal Reserve's huge efforts to use conventional monetary policy to counteract the adverse aggregate demand shocks from COVID-19, the nominal interest rate is very close to zero, and the real interest rate is actually below zero. So that means that borrowing costs being negative, the U.S. government is in a position to get free money to spend in things that one would deem extremely useful. For example, there are a lot of workers who are unable, excuse me, to telework, who have lost their jobs. And in fact, the essential strategy of the U.S. government, which has been to use lockdown as a tool for flattening the curve, which essentially means minimize contagion to the level that one can afford to be its lowest. So here, the idea is that, in next slide, please, is that there is no particular exit strategy in place. So I have already mentioned this. Countries have been forced into lockdown strategies. That's what we understand as saving lives. We all know that lockdowns have humongous, huge, gigantic macroeconomic costs, not least in terms of employment, shutdowns of businesses. And some people say, oh, well, but then after the crisis is over, we'll all go back to work, business as usual, all the old businesses will reopen. Well, guess what? That's not the way it works in reality. There is a huge sunk cost and a huge loss from a crisis like this, from which there might be no recovery. So there can be a very persistent and sometimes permanent effect in macroeconomic terms. So next slide, please. Now I will outline the trade-offs. And there are multiple challenges. One of them was lack of preparedness. So China was where the virus originated, and they put in place a very draconian a strategy of containing the diffusion of the virus by blocking most of the province of Hubei, where the city of Wuhan, with 11 million people, is located. And in fact, after reopening, they've had some problems. Wuhan just this week has started to put into place a policy to test all of its 11 million inhabitants. So in some countries like China and also South Korea and Germany, the capacity for massive testing has been developed. Next slide, please. So why is this relevant? Because if you are not doing a lockdown, which is the strategy to which you are confined, if you cannot do massive testing to control the flows of individuals in society, including workers and other people who are moving around their daily business, then you have contact tracing. But of course, contact tracing requires people to be willing to be tracked through apps installed in their smartphones in a way that the concerns for privacy of the U.S. citizenry would not allow. Next slide, please. The good news, on the other hand, is that while there is a new strategy, the U.S. government is able to essentially have some time to develop a solid way to open the economy, but which also allows for a containment of a potential spike in contagion. So here I consider 6 possible strategies. One is lockdown until vaccine. That's not doable. It will take 12 to 18 months to develop a vaccine. Gradual ease off, that could be, for example, it's been suggested in the case of India by some collaborators of mine and myself as a potential. When massive testing is not viable, that can be an option. And 3 Israeli professors just developed a method for that, for example, based on the fact that the virus in the first 3 days after there is contagion is not spreadable to others. So let's say if you go out in day 1, you can work until day 4, and you are not going to spread the virus to other people, even if you got the virus as soon as you step out of your house. So after day 4, you go back home for 10 days. So you would be contagious between days 4 and 14, and you can go back to work again. So it's a second best option, really, but it's one that takes advantage of the fact that the virus is not contagious to others until the 4th day that it is contracted. So the adaptive triggering scenario number 3, I won't spend too much time on that. It's really like a roller coaster of prolonging the agony and getting the worst of both worlds, because what you do is that when things get better, you release everyone to work, and then when things get bad again, when you get that spike in contagion, you do a lockdown again. So it's a sort of roller coaster kind of situation. Then there are others, but in the case of the U.S., one that is getting a lot of attraction I don't think contact tracing is viable in the US because of privacy concerns. So next, please. I think we can think of massive testing as a possible option. It's been advanced by Nobel laureate Paul Romer, and basically what he suggests is that if you can test 23 million people daily, that will mean that every US inhabitant will be tested on average once every 2 weeks. And since we know that sort of the length of time that it will take for the actual symptoms to appear, and then you can isolate individuals who are contagious, that would potentially work. The major sort of reservations with that strategy is that not many people seem to believe that the US can develop the capacity to test 23 million people per day. Next, please. And that's essentially an issue which has to be resolved. But let's say that you can test not 23, but 10 million or 5 million. Even that will be better than the current sort of strategy, which is to release everyone from the lockdown indiscriminately with the risk of a spike in contagion. At least if a decent share of the population, I don't know, half or 1/3 or 3/4, whatever, can be organized, that would be very helpful. So for that, you need a number of ingredients that are very important and that are currently being developed, because in the last bill, there were 25 billion apportioned to testing, whereas Paul Romer, the Nobel laureate who was advocating this strategy, was asking for 100 billion, but 25 billion is a good start. Next, please. So in general, these are the trade-offs of the 6 strategies that I presented. The lockdown on vaccine number 1 will minimize the health cost in terms of fatalities, but will be very large in terms of economic loss, almost 30% of 1 year of GDP. And then here, the light green is the area to the left before you hit herd immunity. When you hit herd immunity, then you can control it, and R naught can be below 0. But the one that I think holds a great deal of promise is the biweekly testing to some degree. But no matter what, the economic cost will be huge. This will be an economic hit much greater than the Great Recession, which is the international financial crisis of 2008, and will also be probably not as protracted as the Great Depression, but the unemployment numbers are already in that order of magnitude. Next, please. So I think I'll speed up because I don't want to overrun my allocated time, but it is obvious that the optimal lockdown policy needs to take into account that the benefits from the lockdown are concentrated among the old, relatively more affluent, and the costs are concentrated among the young, especially those at the wrong side of the digital divide, meaning some people are not able to telework because the nature of their occupation or their sectoral employment doesn't allow them to work remotely. So well-being declines sharply for those people who are unable to telework, and we need to take that into account. And I think the fiscal stimulus is trying to focus on giving the opportunity for those people to really be able to keep on going for the next few weeks. Next, please. I'm almost done here. So Yeah, so this shows that a policy that is designed to control essentially the loss of lives is well justified, but we have to also think about the loss of livelihoods. And in that sense, this graph here shows how a balance could be struck in the middle, where we are trying to make sure that the burden of everyone in society is mitigated to an extent that policy permits. So the lockdown is a very extreme measure for if you use it for a very long time. However, there are other ways of flattening the curve, including massive testing, including contact tracing, and also including the one I described about rotation of the workforce. So we need to take that into account, because if we open the economy prematurely, the risk is that there will be another spike in contagion, and we will have to do another lockdown, which of course is extreme in terms of livelihood loss, even though it minimizes lives lost. Thank you very much.
Okay, thank you, Dr. Kugler. Next up is Dr. Mayer.
Not so bad drug. So I'm talking about presidential management and politics. In democratic theory, they should work together. We should reward in an election, in the politics, someone that manages a crisis well, and vice versa. So I'm going to start with just one aspect of managing this crisis, and that is testing. And I should say at the start that I think this is probably the thing the president has done worst at. So in a way, it's not a fair comparison. He's done a few other things better than he has done the testing, but according to him, he's done everything perfectly, so he thinks testing has gone perfectly. So in any case, Trump has promised a test for everyone who wanted one. He promised that insurance companies would pay for testing and for treatment of COVID-19. He promised drive-through testing quickly, working with Walmart and others. Almost none of that has happened. Throughout this whole 5 months, or the 3 months when he's acknowledged it's a problem, the president has overpromised and underdelivered, and in no area has that been more true than in testing. Now, the initial delay in testing was not Trump's fault. It wasn't Obama's either, but it emphatically was not Trump's fault. There were 2 key bureaucratic snafus that we don't have time to go into now. But I will say this, it is the president's job to detect those and fix them. And there was a warning in January saying exactly this will be a problem. We need to work with private companies to ramp up capacity, as Germany did, as South Korea did. So it is the buck stops with the president on this one. And this led to the original sin of our national response. In Maurice's presentation, you saw that we'd like to be in a world where we could be tracing and testing early and not be in this terrible situation we're in right now, where we really would be unable to trace all the people in America who have been exposed. Because when you don't have the testing capacity early, you can't trace, you can't quarantine, you can't plan. And it's worth noting that no one would have expected this from the USA. In previous pandemics, America has been a leader because we are seen as a biomedical hegemon. We have tremendous talent in science and medicine in particular, and no one would have expected us to fumble the ball the way we did. And this chart is an indictment of our response. This is early March, or in the case of this one province in China, late February, how much testing, not just as a raw number, but tests per million of people. Folks, we were blind 2 months into this crisis and for a long time afterward, compared to many, many other countries, some of them a lot less wealthy and arguably less well prepared. We did not know where this virus was. We did not know where it was going. And thousands upon thousands, and maybe tens of thousands or hundreds of thousands of Americans will die. I think I'm changing. The chart is, I'm told that my charts are not reflecting what I'm talking about, and they do when I hit it. So ideally, we should have been on testing, and now we should be on a chart. I don't know who's making these changes, but you're doing fine. So the chart here shows how bad it was going with our ability to see where this virus was headed. Next slide, please. So another issue that comes up with the way Trump handled this was federalism. COVID-19, unlike, say, 9/11, which was a foreign policy crisis with domestic ramifications, COVID-19 really is a domestic crisis with foreign policy ramifications. So it implicates federalism, that unique balance between state and national government that we have in America. But in fact, only Trump could have provided a quick national policy response to the virus in the nature of our system. It also raises questions whether all states should have the same response. If you read some conservatives, they're already talking that, well, this shows you the strength of federalism because we don't want the same response in South Dakota that we want in, say, New York City because the challenge is different. But I would counter with that saying that we see in South Korea and Singapore and China, which are far more unitary in structure, they had success with national responses, and from the center were able to tailor to a region, each region, intelligently in a way that I would argue we haven't been able to. Also, Trump's unique refusal to lead on testing, for example, but also on supplies of PPE equipment, meant the cost of response for America as a whole went up dramatically. States were bidding against each other for medical equipment. And that meant, frankly, rich states got more tests and more equipment sooner because they're rich, which really screwed poor red states. When Maryland used its first lady, the governor's wife, to directly bargain in South Korea for hundreds of thousands of tests, that meant that those tests weren't available to other states and the price went up. And there was a revealing quote from the president's son-in-law, who's had a leadership role in our response, despite having a resume, say, lacking in any relevant experience, that he said the national stockpile is our stockpile, not the state stockpile. And then they quickly had to scrub the website of the stockpile, which directly said the opposite of what the president's son-in-law said. Now, it's actually too early to tell if federalism or federal systems are less able to deal with pandemics than unitary systems. But after we look at the data, we may conclude that in a year or two, just some preliminary. I think our response to this virus is going to be studied as a template of what not to do for decades. Switzerland has not actually had a very good response. If you look at their outcomes, their measures of fatalities and cases. Canada's kind of mixed. Germany's had a pretty good response, particularly in fatality. And so those are fairly federal systems, particularly Switzerland. But two pretty unitary systems, Spain and Italy, very different systems, but unitary, have done remarkably badly. So some unitary systems are doing well, so are some federal systems. It's too early to say that the system is implicated. Next slide. Another aspect that we're going to transition from the management into the politics side is public opinion. We know a lot about how public opinion changes in a crisis. There's a rally effect, sometimes called rally around the flag. Whenever there's a crisis, and by the way, this effect happens in most democracies and indeed some non-democracies, the people rally to the executive and to the government in general. And this is true in our country, even when the president is to blame for the crisis, such as the Bay of Pigs or arguably the Iranian hostage crisis. How long a rally lasts depends on the perceived success of the president in responding. Initially, in the Iranian hostage crisis, Carter rose in esteem, and he only declined to below 30 when the crisis was unresolved and he was seen as not handling it well. I would say that Trump really had a very small bump, as you'll see on the next slide, where he rose up, tied his high of 49. By the way, he's the first president in history to never break 50% in the Gallup poll and in the average of polls. But he did receive a 60% approval in some polls for his handling of the crisis. However, he quickly went back down. Today, on the Real Clear Politics, he's around 43.7. And it's looking to me like it'll be more like a Carter or a Bay of Pigs, but it might get a lot worse if we have a resurgence. But throughout his career in business as well as politics, Trump has shown a remarkable ability to act as if he's had a success when, by objective terms, he's had a failure, bankruptcies, poor business decisions, losing millions in inherited wealth, all the businesses that went bankrupt or ended up losing a court decision showing they were fraudulent, as with Trump University. But also in politics, things that have normally killed a campaign didn't kill his campaign. Imagine any other presidential candidate being shown to have made illegal payments to 2 workers in the adult sex industry and still winning an election, or the number of contractors who can look in a camera and say, he ruined my business, he never paid his bills. Trump survived all that with this relentless ability to never apologize, never admit everything's perfect. And it worked in 2016, not only to win the general election, but to beat a pretty strong field of 16 other Republicans running for the nomination. He did this in part because of his remarkable ability to inspire passion. 25% of Americans say there is almost nothing Trump could do that would make them stop supporting him. And that seems to be true. Next slide, please. So this is what surges look like. If you start on the right side with Bush, this is the post-9/11 surge that Bush had. He went up among Republicans in red, independents in gray, and then with Democrats in blue. And of course, the big move is Democrats. Cuomo, governor of New York, had a very solid surge for his leadership in Corona. Trump does not seem to have much of a surge. And by the way, since then, he's gone down back to earth, very much so, back to around 43, as I said. So it's a very, very small surge that he's experienced. We're not seeing a normal rally round the flag effect in this crisis. Next slide, please. And the reason we're not is because of polarization. Now, this should be a moment of unity. I've been studying polarization fairly intensively now for about 2 years, and whenever a journalist will ask me, hey, how is polarization ever going to end? Well, we typically think that a national or international crisis that brings us all together, like 9/11, or this is a video from, or a picture from Independence Day, would bring us all together. Doesn't matter who's a Democrat or a Republican in a pandemic. Your neighbor might be a hated Democrat, but if you need a ride to the hospital for your dying mother, it doesn't matter, right? So this should be that kind of crisis, but it's not working that way. And I believe a lot of that has to do with the man who's president. He's not doing the things that a leader would do to unite us. It's not all his fault. He didn't invent polarization, but instead of using this crisis as water to pour on the fire of polarization, it's gasoline. He's still pouring gasoline on the fire of polarization. And I would argue that's making us more vulnerable than many, many other nations because we aren't united. So polls show that people don't believe the virus is serious if they're Republicans much more than if they're Democrats. And that's because we don't even agree about the truth anymore. Next slide. So the long-term impact. Well, the normal rules of presidential elections are that it's peace and prosperity. And actually, I was thinking Trump was looking pretty good for re-election, about 55% likely to be re-elected by normal models. COVID-19 should change the rules, change that, certainly will change those models, right? Because they're based on presidential approval and GDP and a couple other variables, and that's a disaster for his re-election hopes. But remember, Trump was already an unpredictable force in elections, so is COVID-19. It should change the rules, but it's not, it's such a black swan event, and Trump is such a black swan candidate that you shouldn't feel confident if you're a Democrat that, hey, we got this. Normally, I would say, yes, you would, but it's Trump and it's a black swan of COVID-19. Now, granted, if November dawns and the president is widely perceived to be flubbing his response to this pandemic, as I believe he has by almost any objective measure, it will be almost impossible for him to win. But if he's perceived to be successful, hard to imagine his defeat. This election will be about COVID-19 and almost nothing else. And there are ways in which the president is moving to make a case for re-election, among them blaming China. And also, if you look at the data right now, we are not the worst, right, when you look per capita. So, and we're also not the worst in terms of percent of people who get it and die, and percent of the general population, the deaths per 100K. We're getting worse with every passing week, but we're not the worst. So some arguments are going to be made about the numbers. Next slide. The longest term look is this is a seminal political event, not just for the United States, but for the world. Global crises like this pandemic often signal shifts in power and rise of new models of governance and ways of being. World War II ended the British Empire, and I give you some other examples. And ask yourself, is there anyone out there in the world looking at the American response and going, man, I wish our government was more like that? No, you're thinking of South Korea, you're thinking of Taiwan, you're thinking of New Zealand. Those are the models. And there's a couple really good responses in Georgia, the nation, not the state by any means, that are also going to be looked at as models. China is rising, even though they mishandled the first month of this very badly. If China is the model, freedom could diminish around the globe, or even maybe here. However, the West could come roaring back. Remember that Spanish flu had very little global impact in terms of policy or models, killed 50 million people, but less important at this macro level than I would argue this World War I was. And with that, I'll be happy to answer a question about Sweden when we get the quick Q&A. Apparently someone had one, but I'm going to turn over the time to Tonya.
Good afternoon, all. I would like to thank the organizers and my fellow panelists for the opportunity to speak today. Before getting started, I would also like to thank Dr. Nathan Myers at Indiana State for his timely work on this project with me. Accountability, hold on, we're not there yet. Okay, accountability, polarization, and federalism, oversight during and after the COVID-19 pandemic. Our reality is changing. We live now in uncharted waters, unprecedented times. Societal risk and threats are increasing. The international community faces a series of disasters or these threats each year that cause thousands of deaths and cost billions of dollars in recovery aid, disruption of commerce, and the destruction of homes and critical infrastructure. Today, we are facing new threats: economic uncertainty, social depression, health concerns, political disconnectedness. All of these have caused intensified anxiety for our country and international community in the face of the coronavirus pandemic. The impact of disasters, whether natural or man-made, is also increasingly felt in the governing world. That is the densely interconnected web of social and political environments. Hold on. So what do we mean when we talk about natural hazards versus man-made hazards? Well, we all know that natural hazards are rooted in the natural environment. They are often considered acts of God. They are thought to not be preventable, and they're associated with this perceived lack of control, because if you are not in control, some higher power, some higher entity is in control. Man-made hazards, on the other hand, are always caused by humans. Sometimes it's malicious, sometimes it's negligence, sometimes it's a system failure. It's thought to be not predicted, but preventable, and some type of identifiable party usually is held accountable, maybe not to the degree in which we would like to see, but typically so. And this is associated with the perceived loss of control, because you are in charge as compared to natural hazards, so when you lose that control, typically results in some type of failure. An important part of this web in the United States is our federalist system. Americans have long viewed our federalist system with shared power between the local, state, and federal levels as a strength. This system can allow for useful experimentation to respond to varied policy challenges. However, COVID-19 is the latest example of the complications it can also create in the face of grave threat. The tectonic shifts of globalization the expansion of democratization, and the nexus between security and sociocultural respect each present a variety of policy and administrative challenges. It is the essential role of government to implement policies that positively manage punctuated events of significance and their associated consequences. In the midst of a public health emergency like COVID-19, the federalist nature of the public health and emergency management systems can create particular complications, to say the least. The U.S. Constitution and Supreme Court precedent has long established the states having primary authority over public health events or emergency management events, disasters. Federal statutes also dictate local response until resources are overwhelmed or until a declaration of a national emergency is made. States can either exercise centralized public health authority within their borders, allow counties to exercise decentralized control, or use a hybrid system. Meanwhile, the federal government possesses considerable resources in terms of the knowledge, personnel, and material, but limited ability to exercise power except at the state's invitation. Such a complex system may work well under normal conditions, but in the face of a global pandemic, exactly what we are seeing, there's a deficit in the response, and it's a deficient one at best. It has created challenges for elected and public health officials, as well as emergency managers and first responders throughout all of our counties, throughout all of our cities, throughout all of our states. From the day it became apparent that the U.S. would be hard hit by COVID-19, the Trump administration confronted criticism of its slow recognition or acknowledgement of the viral threat, mismanagement of acquiring and distributing resources like personnel, protective equipment, and ventilators, lack of clear and consistent messaging on social distancing, and delays in establishing federal testing apparatus. These issues have trickled down to present further difficulties for governors and local leaders while trying to manage the ongoing crisis. The shifting messages from the White House has led to local disputes and protests over stay-at-home orders and the reopening of our economy. Counties are opposing the policies of their governors, while cities trying to come down from the peak of infections are concerned that more permissive policy in rural areas could jeopardize their progress as well. Members of Congress have sharply critiqued the Trump administration's performance and enumerated the serious gaps in the executive response. Some have even argued that it has been a dereliction of duty. However, Trump and his supporters have dismissed the criticism as part of the impeachment hoax, or that this is a China virus. Also, the president's lawyers and congressional defenders acknowledge that he engaged in maladministration in regard to Ukraine, but supported him anyway. As for non-congressional oversight, Trump has already removed several federal inspector generals who would be expected to provide a nonpartisan assessment. Further, history has shown that bipartisan commissions like the 9/11 Commission can still be affected by political maneuvering. As the president acknowledged himself on Twitter, COVID-19 is America's first 50-state natural disaster at the same time. However, some governors decided that each state having its own solution would only add to the chaos. Lack of federal coordination has led to governors forming bipartisan consortiums to acquire ventilators and to develop plans for reopening. We are seeing this notably here in the DMV area. To varying extents, Republican and Democratic governors have gone on record in the media to refute Trump's claims that governors have not effectively used federal resources. If there is to be a true accounting of the strengths and weaknesses of the federal government's COVID-19 response, it will need to come from the governors. Polling consistently shows many governors. Let me go back. Yeah, nope, we're not there yet. Sorry. Sorry. Polling consistently shows many governors outperforming President Trump in terms of their COVID-19 response. While each state will need to write its own after-action report, the message would much be more impactful if these consortiums wrote a joint after-action review signed by both Republican and Democratic governors. Not only would this be a clearer document for history's sake, but it would also be more likely to break through the partisan noise and resonate with the American people. Social capital and political trust are key elements to good governance because they affect the willingness of individuals to support the government as well as public policies, especially those that demand some form of sacrifice. I think we can all agree that we are seeing that right now. This requires a belief in the fairness of a shared future, If individuals do not feel that the government shares their concerns or that institutions are rigged against them, their loyalty, their trust, and social cooperation are in danger of being eroded. This can happen on various levels of government and can involve both formal and informal institutions. Furthermore, there are specific events that cause added strain and potentially fracture this cohesion and resilience, which make certain time periods for examining these levels especially relevant. The COVID-19 pandemic is one of those times, and as we saw yesterday, the massive flooding of the dams being breached in Michigan and the early signs of a very active hurricane season will even add additional punctuations. Okay. Global challenges remain. However, disasters no longer occur within a limited geographical scope. Traditional crisis models have typically focused on post-crisis response recovery and lessons learned from terrorist attacks, civil defense. Policymakers are therefore ill-equipped to handle many of the social, environmental, and economic elements that many of these threats and hazards pose. As communal networks are disrupted, even disconnected, there will be a lasting impact on the vitality and the social cohesion of the community, as well as the political confidence among its individuals, therefore having a negative impact on the communal resiliency of the area. Understanding the causality, the severity, and the incidence of crises, including COVID-19, is essential to our problem-solving process, and it will be very much ongoing, just as the former panelists have mentioned. The process of collecting, analyzing, and appropriately interpreting this information requires buy-in from all stakeholders. The right communicators will also be required to make the case to the American public, and based on performance and public approval, successful governors and possibly presidential candidates or President Trump, among all parties working together, would have the best and most meaningful impact. There are many locally and regionally based solutions. As noted, the DMV have organized response compacts of sorts. They've increased their communication as well as enhanced their cooperation in times of this disaster. And people have recognized that as an important and a relevant means to ideological bridge building. When before have we seen such two governors of different political parties and a very strong mayor come to the table to truly work on a bipartisan response? Given the limited opportunities for crisis-related experience, decision-making models have highlighted a need for collaborative partnerships. Information sharing is critical. It is a critical need for the effective and efficient administration of response activities, as well as the preparedness. Increased communication and enhanced cooperation in times of threats should therefore be recognized and as important and viewed as a relevant means to ideological bridge building that aims to strengthen the country's social cohesion and political confidence. Therefore, an integrated approach for community resiliency and sustainability should be developed that integrates public health, homeland security, and emergency management. Moving forward, these elements are just as important from the organizational learning perspective as they are in the thick of a response. Governors will need to continue to collaborate to manage future outbreaks and downstream effects of COVID-19. This will involve sharing of lessons learned and communicating to promote the implementation of needed reforms, the effects of which definitely cross state lines. Just as the former panelists have mentioned before, this impacts everywhere, it impacts everyone. Governors must also model cooperation in the face of partisan in Congress and within their own states. And then finally, state governors have been and hopefully will continue to be national leaders in this effort by working across partisan lines for a safer response and recovery. They must make certain that the lessons of this pandemic are not lost to history and are remembered, not as partisan sound bites, but as the heartfelt wisdom and experience of duly elected leaders. The collecting and sharing of their institutional knowledge will advance our capacity to manage future risk and increasing complexity. Thank you, and I will now turn it over to the next panelist.
Hello, everyone, and good afternoon. Thank you, Dr. Koblentz, for the introduction. And thank everyone for joining us on how COVID is really reshaping all our experiences and what I'll be talking to you about is reshaping our travel experiences and what's been going on lately. I know about you, Beth, it was just only 3 months ago when we were comfortable in a packed aircraft. But now we're thinking our own habits and our own travel habits. And I think not just for COVID, but for something that will go on for the future. This will make overall for this healthier society. Some things that are going on right now, you can see a picture there of an individual who is in Qatar Airlines, who they just recently announced that they will be doing full PPE for all their flight attendants. And there in the middle, you also see a lot of prepackaged goods. And in a lot of airlines currently, you're not going to see a lot of in-flight services. What they're trying to do is minimize a lot of person-to-person impact, because COVID is a disease that spreads through droplets. So if you can avoid touching other things that other people may have touched, that one itself prevents the spread of disease. So all the things that we're doing, all these travel experiences, all these social distancing, things that we're doing in our normal life are trying to stop the spread of the disease. And not just for COVID. We're talking about that right now, but what about the next seasonal flu? This could actually prevent us going into the next phase of having a lower flu season just because of the things that we're implementing now, and hopefully for the next emergent disease that may occur. Next slide, please. As you see, before COVID, we had 4.5 billion air journeys a year. And I truly believe that we're going to get back to that. We're just going to make a couple small changes. But historically, epidemics, way back in the 14th century, epidemics weren't air. They were done by ships. But you can see with air travel, we can go from one place to the globe to another and in a matter of hours, where before it was a matter of months. The term quarantine actually is an Italian term for quarantino, meaning 40. And that was in the 14th century when ships came to dock into Venice. They actually kept them off port for about 40 days to ensure that they weren't coming on with symptoms of the plague. Kept them offshore, making sure they were okay, and so they were getting quarantined. Now we are doing things like self-quarantining, making sure we're not exhibiting symptoms that we can go ahead and pass along to others. Next slide. So you probably all remember, before March, we had those packed aircraft, no masks, and tons of flying. Now, by April, we're down to, recent studies say 5 to 10% of where we were. I actually personally had a flight going from here to Colorado and then back again, 4-leg flight, and it was at the end of March. I had my own row for that. As we get more comfortable, as we start putting more public health measures in place, we may not have our own row, but as of right now, those are kind of things that we're seeing and seeing what other things are going on. So next slide. So will traveling make you sick? You probably thought way beforehand, do you get sick every time you get on the aircraft? Is it the aircraft? Is all these people crammed in the aircraft making you sick? Is it the airport? Or is it you or other people's unhealthy habits? What can you do yourself for that personal responsibility to keep yourself healthy? And what can we ensure that others do to make sure that we all stay healthy? Next slide. The aircraft itself actually has been always a protective factor way before COVID. It is the policy of aircraft to change the entire volume of the aircraft every 2 to 3 minutes and put that volume through HEPA filter. And so what happens when you're flying is that the aircraft, the engines will actually take the ambient air, mix it in, and then bring it through the roads, through HEPA filters, taking out 99.9% of most biological contaminants. And that was way before COVID. So it was actually a protective factor and still is a protective factor for most diseases, viruses, and bacteria. So as the aircraft comes up, you can see the picture on the slide, as it's coming through the top, it goes actually across the rows and down through your feet as it gets scrubbed through the HEPA filters. So if you're sitting in row 23, for example, and somebody is coughing in row 10, then the person's coughing, you will probably be protected from the cough particles of row 10. So as of right now, if you have to travel, try to get those empty rows, because that's where you're going to be most protected. That's the best social distancing. And later on, household members to try to stay in that same row, because that's where the air circulation, that's where you're going to be breathing in the same row. But as of right now, I haven't seen any reported cases of COVID transmission in flight. Next slide. So remember that person in row 10, and they were coughing and you were in 23, but where were they before you got onto the aircraft? Were you sitting right next to them in these crowded airports? Were they right next to you in those check-in lines? Especially in a time when we went to the airport 2 to 3 hours beforehand and sat there, went to the concessions, went to the restroom. Social distancing is now going to be part of our mantra of what we're doing now in everyday society. So before, when there was those long lines, now when you're at the airport, they're trying to do a very good job of trying to stop the in between the seats, keeping cohorts together, family members, household members away from other individuals. So this social distancing is something that I see will continue on even after the COVID epidemic. Next slide. But you've probably heard it lots of times, 15 days to slow the spread, 30 days to slow the spread. The number one way that you can stop the spread is to wash your hands. Wash your hands a lot. And wash your hands when you go to the restrooms. Anytime you see hand sanitizers, whether it's in the supermarket, whether it's on the jetway, whether it's anywhere else, just swipe your hands down and use the hand sanitizers. Using the bathrooms, because soap and water is still the best. But when you don't have soap and water, carry around those hand sanitizers in your wallet, in your purse. And from a travel perspective, TSA is now allowing 12 ounces of hand sanitizers in your carry-on, as well as wet wipes. So that is the large set of hand sanitizers. So they're encouraging you to bring that on. And that way you can wipe down things on your own seat of things that people normally touch. Remember, again, COVID is a droplet, is dispersed by droplets. So anything that people touch, try to wipe down. It's in that same flight, I did bring my hand sanitizer. I brought the wet wipe. And actually, most people were doing that. This was before the mask, but everybody was starting to bring on their wet wipes. And encouraging yourself to have good coughing habits. And the wearing of the mask actually prevents that touching of your face. If you do happen to touch something that may be infected, some people don't realize how much they touch their face in just a normal setting. So you wear your mask, and put your hands on your face, don't even realize it. So use those hand sanitizers as much as you can. Next slide. So this is our new normal. I can't emphasize the good hand hygiene as much as I can, but something that is probably very different, or what we need to think about as a society, is that traveling while ill. When have you ever thought, I don't think they'll ever allow me on that aircraft with this cough? You might get those sideways views and saying, why are you sick? But nobody's really canceled unless you're on your deathbed or, going somewhere. That is something that we need to change as a society. And economically, airlines need to help us to say, okay, we're not going to get a financial hit to have this personal responsibility of saying, I am ill. Make a responsible effort of having your own thermometer, taking your temperature, and saying, I am not well to travel. I do not want to spread other things. And you've seen those thermal checks pop up at offices, in doctors' offices, other offices, and they may be popping up at airports as well. But social distancing, wear masks, we're all trying to start a new normal. Thank you.
Thank you, Dr. Sevilla. I think all the panelists have given us a lot to think about in terms of the economy, politics, disaster response, and travel and tourism. So I'm sure there are a lot of questions from the audience. So we're going to ask you to submit your questions via chat. And if there's a specific person you want to have answer your question, say so. If not, you can leave it open for anyone to grab at. I'm going to start off directing a couple of questions that we already received. There's a question for Dr. Kugler. Using the assumption that a vaccine is not developed within the next 12 months and that the most likely scenario is number 3, adaptive triggering, how long will it take for the U.S. to lose its economic superiority? Assuming that other countries are able to provide similar services digitally, at what point will other countries realize that it is cheaper to hire or buy outside of the United States?
Yes, I actually happen to think that scenario number 3, the adaptive triggering, is the worst of both worlds. So that's like the prolonged agony scenario. So in my view, before we go all the way down to that, we should have something that is more like a strategy than sort of Hail Mary, like a hopeful, wishful thinking strategy, which is the one that is being advocated by some policymakers, essentially open the economy and let's hope that there is no spike in contagion. Well, as far as I understand the scientific evidence from epidemiologists, there is a high probability, or at least a non-negligible probability, that if we open without any other measures to flatten the curve, there can be a spike in contagion, and that will mean that we're back to square one. So these 3 months of lockdown, or 2 months in some states, 1 month in some others, will be completely wasted by the wayside, and we're starting again from zero. So that's the big challenge, that we will be in a roller coaster sort of dynamics for a very long time. However, I think the Israeli strategy of releasing people to the workforce for 4-day spells and then have them rest for 10 days could well work, or preferable also to adaptive triggering would be some sort of massive testing, even if it's not 23 million tests per day like suggested by Paul Romer. It could do 10 per day, but I think we can do much better in the massive testing as the U.S. As Jeremy pointed out, we have the wherewithal in terms of scientists, human capital, technology, private sector, pharmaceutical companies, and so on. Thanks.
Thank you, Dr. Kugler. There is a question for Dr. Neaves. In a post-COVID world, where do you see the local, state, and federal pandemic preparedness posture going? State and locals seek to beef up their own programs and not rely as much on federal aid.
Thank you for the question. We saw a similar response with local and states impacted by Hurricane Katrina. So yes, I do believe that state and locals are going to start moving into their own areas with respect to emergency management, particularly developing more regional consortiums and compacts. The $1 million question, though, is how are they going to afford it given the crushing economy of local governments and every other service that they need to provide to, where the rubber meets the road, whether it's trash pickup or water sanitation or, teaching, et cetera, and law enforcement and fire. Additionally, how are the feds going to react given the military and paramilitary nature of FEMA? So this brings me to that last slide that I showed everyone. I do think the local and state response is doing a much better job of integrating emergency management, public health, and homeland security, and finding that sweet spot of being able to talk with one another and jargon-free, and also understanding that you're not an expert in every area in order to move forward in terms of making substantial progress.
Thank you. There's a question for Dr. Sevilla. Do you think we will see permanent changes to how air travel is conducted? For example, mandatory temperature check before boarding? Will some of these practices be a new norm to spot the next outbreak early? Is this sustainable?
No, in terms of is it sustainable in terms of temperature checks, not with the current technology that we have and the current policies that we have. We have done temperature checks in the past when H1N1, SARS, even Ebola, and those were done right in the middle of those crises and may have helped, if nothing more than to deter people to travel when they were ill. And I think that's being in my last slide, saying don't travel while ill, is something that hopefully in the long run, people start thinking about, I am not going to travel. If those temperature checks are random, it may be a deterrent to say, I don't want to get caught of a possibly sick if they're not going to allow me on that aircraft again. So do I see it that everybody will get their temperature checked each time, every time you go onto an aircraft? No. Will it pop up in the middle of this crisis right now to try to stop the epidemic? Probably. They've already done that. They did a week test at Dulles just last month, and the current administration is thinking about doing things, but I do not see that as a new normal.
Okay, good to know. Another question about, in Fairfax County, they're promoting a policy called One Fairfax to promote racial and social equity. Given the troubling and vast negative disparities impacting minority populations across the country throughout this COVID-19 pandemic, how can public policy inform positive changes to this dynamic? Dr. Neaves or Dr. Mayer or Dr. Kugler, would you any of you like to take this?
I think that we are seeing a tremendous disparity racially and economically, that the people who are most likely to die, get this disease, it is inequitably distributed, and the economic consequences as well. I think public policy has a strong role to play in this. The first tranche of bailout was heavily weighted toward Wall Street, and I think we can do a lot better. There's also people that are getting very rich right now, as most Americans are seeing their 401ks and their family savings decline. Jeff Bezos, for example. So I think radical proposals on health policy and on tax policy are well in order.
Gregory, this is Maurice. Can I also mention a couple of factors? Hello?
Yes, go ahead.
Okay, thanks. Yeah, so I totally agree with Jeremy that the inequality, which has been growing in the U.S. and also in other countries with globalization, will be exacerbated by COVID-19. And this exposes the fact that not everyone in society has access to the same level of safety nets or opportunities. So one aspect I mentioned in my presentation is the digital divide. Only a small share of people can actually telework. Those are the ones called by David Brooks symbol manipulators, the people who can work on computers mainly. But many people who are in manual labor or services are locked out from having a decent income. And the other factor is that the density in terms of the number of people per dwelling among the poor is much higher, and they live sometimes in community housing that involves going in and out to try to make a living and taking some risks that people in the suburbs or who are able to have their own house, their own dwelling, don't have to face. And the last factor I wanted to mention is that it is true to say, as Jeremy was mentioning, that the bailout initially on the business side was not really targeted to true small and medium-sized enterprises. It actually did go, so like any firm that had one establishment or plant with less than a certain number of workers would qualify. So you had huge corporations that were getting money that was meant to go to small businesses. So what's the deal with small businesses and medium enterprises shutting down? Well, that the big guys have less competition and have more monopoly power, which means that the consumers in general have to pay higher prices, and those firms have bigger monopoly rents, which further concentrate wealth.
Dr. Koblentz, I have one quick thing to add to this. In the early 1900s, we had a penalty associated with urban living, deforestation, density of living. And about 1985, we saw a reversal in that, and there became a mortality penalty associated with rural living. And this had to do with a number of things: lack of access to quality health care, poor health outcomes, decreased life expectancy, increased mortality, and a number of factors. And Christopher Murray developed these 8 Americas of where these disparaging health outcomes were occurring. I do think that even with social distancing being more effective in areas, in these 8 Americas where they're already suffering such disparities, if they don't practice social distancing, you could see quite a spike in those areas, and particularly when they don't have adequate resources, let alone adequate health care or access to it.
We have a question about what is happening with Sweden's bold refusal to adopt a full lockdown. Are they succeeding?
Well, so I mentioned several countries, and I have been following the events in Sweden, and they are doing better than a number of European countries, but they are by far the worst in the Nordic region. So the jury's still out on whether this is going to work, but they are rising in their number of cases and fatalities and far above the region. So I don't think at this point, we could change our mind, but this model doesn't look like it would work for us or any other country. And it is also worth noting that the reason that they've remained open is for economic benefit, but they aren't doing any better economically than their neighbors as well.
That's a good perspective to have. Okay, we have a question about far-right extremist groups seem to be using the pandemic as a rally for political and social disruption. How do local governments counter this?
I would say that local governments have to confront this strongly. Any violation of the law that is done by one person or by a small militia is a threat to the public order and should be dealt with swiftly and strongly so that it doesn't become a model for actors all over the country.
All right, another question about the decision to reopening. Is it simply an acknowledgement that livelihood for all is more important than the death of a few? What are the triggers, such as fatality rates, that will justify the reclosing of our economy?
I think it stems, this is Maurice Kugler, partly from the fact that there is a lot of uncertainty on the scientific end. So no responsible scientist will tell you what is the exact probability that if we open tomorrow for business again, there will be a spike in contagion. However, they can tell you it is very likely. Normally, scientists, when they have studied a problem for a long time, they have a fairly precise estimation of these probabilities, and they can bound them very tightly. That's not the case with COVID-19 because it's such a recent phenomenon that there hasn't been enough time to study it. However, the serious scientists will tell you we cannot pretend that we can reopen and this will be just like the influenza A or B, the regular flu. It could be a lot worse. First, because the virus is a lot more contagious than anything that has been seen recently. That is sort of established. And the other is that it's lethal for certain populations. But it is true that those populations are not apparently extending to everyone who contracts the virus. But even then, it would be extremely dangerous to open the economy without an exit strategy. And I think it behooves policymakers to have a serious alternative to flattening the curve if they are decided to abandon the lockdown. So don't get me wrong, I agree that it's imperative to end the lockdown as soon as possible because the cost in economic terms is huge, especially for poor people who cannot telework. However, to do it without a measure to continue flattening the curve is extremely dangerous because when we get the spike in contagion, if it happens, we're back to square one and we will most likely have to lock down again, which is not what we wanted. So I think an exit strategy is good for public health and it's good for the economy. We cannot just open prematurely without a solid plan.
Dr. Neaves, did you have something you wanted to add on that question?
I agree with Dr. Kugler. I think that much like in the spikes that we are seeing in COVID-19, particularly here in the United States, if we are not careful with our own individual social responsible practices, as well as paying attention to the guidelines for those economies that are reopening, and I have mixed feelings about that, place does play a part in how people pay attention to what necessitates certain social behaviors, acceptable social behaviors. But at the same time, if we're not careful, if we see a resurgence in the contagion, we'll similarly see a resurgence or a decline in our economy. And so having the bomb fall out twice will be even more devastating. And I know this morning on CNN, they were talking about how if we do this again and not the right way, it could have irreversible damage to our economy in moving forward.
Okay, we have a question for all the panelists, so this is fair game for anyone who wants to answer. Is there a risk that in the post-COVID era, public health programs become politically polarized, with conservative states defunding public health and pandemic response programs at the state and local levels?
I'll share some of the insights that I have about this. I can see why people think that it could be polarized, especially as we see the conversations play out between the Trump administration, Dr. Fauci, and the CDC, especially the former CDC director and his new report that's out in terms of the color-coded kind of index similar to DHS's with a terrorism threat. And so, but it's going to be kind of a long way out before we really see what the impacts are on how local government and state governments kind of come together and coalesce. As many of you may recall, after 9/11, there was the implementation of fusion centers, which was to put in each state and then also regionally in order to kind of help information share and collaborate on events of significance, particularly terrorist attacks. We saw that was not very well put together or operated. And so I think that there's going to be an attempt to do something similar after this with a fusion center of its own kind, but particularly around threats and disasters that are not terrorist related. And so it could mushroom from there. Too early to tell from my perspective.
Yeah, my take on it is that I think the red state, blue state divide on pandemic response has been a little bit overblown. Some of the governors I've seen who've been particularly active on this early on, like Governor DeWine in Ohio and Governor Hogan in Maryland, are Republican governors. And certainly there have been some Democratic governors and mayors who have lagged behind the curve. For example, de Blasio in New York City in terms of shutting down things earlier than, or not as early as he should have. So it's not clear to me that there's really going to be that kind of divide based on the politicalization, but that general trend of politicalization of public health is definitely a concern, especially what we see coming out of the White House and from some senior members of the Republican Party. So that's definitely kind of a long-term concern. But again, it's a little bit too early to say whether kind of a political party affiliation really drives pandemic response. So I think we just need to keep a close eye on it and be able to look at kind of a case-by-case basis. All right, we have a question for Jerry Mayer. The Carnegie Endowment for National Peace finds that trust between the U.S. government and the people have been at a historic low. With the Michigan protesters as an example, how does the government plan to gain the people's trust to govern properly?
Well, let's be clear. The protesters in Michigan and in any other state are an impossibly small minority. They make the Tea Party look like a multitude. So don't overreact to that. But trust is crucial here. I'm doing a paper right now on cross-national comparison of responses, and trust is so important. Another one of the questions is referring to, is this bad news for democracy that centralized and autocratic governments seem to be doing well? Don't believe the hype. New Zealand is not an autocratic government. Taiwan, South Korea are vibrant democracies. They are doing great. But what all three have in common is a level of trust in government that we haven't seen since John F. Kennedy had the headache in Dallas. So we have a long way to go towards trust in our government. And if you don't trust your government, and one party in our system has been telling us relentlessly, government sucks, they can't do anything, then you probably will have people who don't comply with their mayor, their governor, or their president if he were actually asking us to do so.
Yeah, I totally agree. And if I may, I think an important element of this issue about trust is the fact that evidence-based policy has become less popular lately. And what seems to be the flavor of the day is to have your own alternate version of reality that suits your ideology and act on that basis. So in that world, serious, rigorous scientists become just another talking head in the dialogue that can be as trustworthy as someone who has no clue about science, but happens to believe that the whole COVID-19 is a hoax. And we have seen so much misinformation, and I think it's associated to this issue of mistrust that we really need to come back to a national dialogue that is based on facts and on reality, and not on interpretations and ideology.
All right, there's a question for me from one of the audience members. A recent NBC article argued that COVID-19 response revealed that the US and UK are vulnerable to bioterrorism. Further, terrorists will begin to have more of an interest in bioterrorism due to COVID-19. Do you agree with the assessment? There's certainly some good evidence that some groups have expressed more interest in biological weapons than in the past, particularly extremist right-wing groups in the US have talked about the use of COVID-19 as an accelerant for their ethnic cleansing, white supremacist types of plans. And you've seen some also talk among different jihadi groups about the role of the coronavirus in facilitating their efforts to, topple governments in the Middle East. But so far, what we've just seen is rhetoric. There hasn't been any concrete action taken to actually use the virus as a weapon or to discuss ways of actually doing so in any kind of realistic fashion. So there might be some, uptick in interest, but this is not translated at all into capability or actions. And that's actually pretty typical for terrorist groups in general. These types of weapons are typically not well liked by most terrorist groups because they're indiscriminate, they're hard to control, and the use of disease as a weapon still kind of violates a taboo that even terrorist groups are unwilling to go across. So at this point, I think some groups have definitely shown themselves that we need to have much closer watch on them and their activities, given this level of interest. And on the flip side, one of the very few silver linings in this is that the fact that these vulnerabilities and weaknesses in our public health systems have been exposed also means that we can fix these problems. So I think we'll come out of the pandemic with hopefully a much stronger public health and medical system, more capable of handling mass casualty events, more capable at detecting outbreaks early and identifying cases and isolating and quarantining them as appropriate. So hopefully our overall vulnerability and susceptibility, these kinds of attacks will decline based on the responses we take to revitalize our public health emergency preparedness system after the pandemic. And that is an important end goal to have in mind, that these kinds of preparedness for naturally occurring pandemics also have a benefit for preparing for and detecting and responding to any kind of deliberate attempt to misuse biology or biological agents. So that's something important to keep in mind moving forward. Okay, we have a question that a major concern is that some governors are withholding the data and lying about the number of deaths and cases in their states. Is there a way to stop this? Do public databases still provide the correct information? And so I guess it's going back to the trust question that Dr. Mayer addressed earlier. So what do we do about the integrity of the data that is being published by different state governments and agencies?
So there have been two cases coming out of Georgia and Florida that we should all pay attention to more closely. There was an incredibly deceptive chart that the governor of Georgia had prepared, and it misrepresented time. The days were shifted to make it look like cases were declining. And then in Florida, the data set's author and owner just basically said I was fired because they wanted me to change reality. So these are very, very important questions. I think over time, the truth will out. You can't hide dead bodies forever. But in the short term, the 6 months, 3 months, these are really, really big questions. And again, I think federalism is implicated because a strong central government would be able to tell each state, we're going to count this way. But right now, states are using different kinds of counting. And so what a number from Connecticut means is very different from what a number from West Virginia means, because they may be counting deaths and cases very, very differently.
I'd like to add to what Dr. Mayer just said in terms of in Virginia, the governor not realizing how the statistics were being reported in terms of infections and deaths. And so he worked very diligently once that was pointed out to him, or once he was ousted, not sure what is really the truth. But at least he worked to address it very quickly. So hopefully those numbers are more reliable. And as this becomes a more evident problem with other states, I'm hopeful that their respective organizations and agencies and leaders will do the same.
We have a question about the increase in technology requirements for local government. Has been notable in part to facilitate the massive remote work that government employees need to do during the stay-at-home order. How can local governments with tight budgets and recession ramp up their technology needs in light of this pandemic?
That's an excellent question. Local governments right now are certainly hurting, especially those local governments in which restaurant, food taxes, meal taxes, and otherwise are causing a major decline in their revenue source. And so trying to furlough individuals and whether or not those people come back on board full, as a full FTE. I believe that a lot of local governments are reaching out to some of your smaller consulting firms, local government consulting firms that can help provide some of those services that aren't being paid a premium at the 100% FTE and bridging those gaps between one locality or the other. I've also been seeing a lot of localities kind of create their own regional consortium or compact in order to pay for a full-time individual to kind of coordinate those efforts. Each state is responding differently based on what their capabilities are. In Virginia, the Dillon rule had to grant special provisions, the Attorney General and the Governor, by the direction of the Governor, in order for governing bodies to even be able to hold business meetings that did not discuss COVID-19 to come together to make budgetary decisions, to make other types of decisions that aren't directly impacted by COVID-19, but everything's tied together in that system. And so it's been a work in progress, and each state and each locality has been moving differently through it. I think in the next couple of months, we're going to be able to see, especially after the beginning of the fiscal year, how that's really going to impact them.
Okay, we're getting short on time, so I think this will be our last question, but I think it's one that each of the panelists can answer. some of the president's response has been discussed already, but what are your general thoughts on how the CDC, FEMA, DoD, and I'll add in any other government agency has supported the COVID-19 response on behalf of the U.S. government?
Well, I'll start. I think the CDC stumbled coming out of the gate. They have egg on their face for their initial response on testing. That said, I don't think they've been doing a bad job since then. I think they've been facing unprecedented political pressure on things like their guidelines. They should have been the ones holding these daily press conferences, but their ability to speak directly to the American people was controlled live on television every day by the president.
I think, just to be brief, because I know we're running out of time, the main flaw I have detected is a general slow response. So after the initial information was received that an action needed to be taken, it took 1 to 2 months to get going. And that's true about developing massive testing capacity, as it is true about starting the lockdown. And you can talk about what happened in New York with the subway staying open for so long. So generally, a lack of awareness of how acute and grave the whole situation was.
I think that everyone knows what their strengths and weaknesses are, and this just enhanced that, especially their weaknesses. And doing that interagency collaboration, they realized we do this well, but I didn't realize what CDC and FEMA and the DoD, what they did well, what they did poorly, and how we can communicate and keep things transparent. And I think things like that and the lessons learned will help us for the next time.
And to add to that point, it's almost as if, bringing all these major federal players together and an emergency operations center with a point of contact, and the incident commander was not very clear in this crisis response. And so moving forward with a public health pandemic, that's going to be a very critical role, and it can't just be led by CDC. It can't just be led by DoD. It can't just be led by FEMA. It's got to have someone who has that leadership and oversight and understanding of all the important players at the table.
And I just want to agree with that. I think we can all point to the failures of individual agencies on different aspects of the response. But what's really been telling to me is just the overall lack of coordination among agencies, because you really need to have a whole government response to something as massive as this pandemic. And we just have not seen the leadership from the White House to make that happen. And I think at the end of the day, that's going to be a huge feature of the lessons learned type of report that we see, moving forward. So with that, let me thank all of the panelists for joining this event today, and thanks to the alumni chapter for organizing this, and to Zaven Smith for his behind-the-scenes wizardry to make sure it went smoothly. And finally, thank to all of you in the audience for tuning in and listening to us and submitting your questions. I'm sorry we didn't get to all of them, but I'm sure individual professors will be happy, and alum will be happy to respond to any questions that we did not answer to your satisfaction. So thank you, stay healthy, and wash your hands. Bye.